Breaking tonight, concerns over the Delta variant and what is happening with the possibility of booster shots, not only for the immune compromised, but possibly for everybody. Is that on the front burner? Let's bring in Dr. Francis Collins, director of the National Institutes of Health. Thank you, sir, for being here.
Glad to be with you and to talk about these things, Brett.
Yeah, it's important. People have a lot of questions. Peter referenced it in his piece. It was an Axios piece that was titled, "Biden's Big COVID Challenge, Fading Vaccines May Demand Boosters." Here's how they quote it. "I think everybody believes this wanes over time. The question is, to what extent?" According to a senior Biden official. That debate is hamstrung by a severe lack of clear data from the CDC. Even top administration officials can't get the information they want, making it harder to assess when boosters will be needed and for whom. The vaccines are still having a positive effect, but we're painting this train as it's going 180 miles an hour, said Michael Osterholm, director of the Center for Infectious Disease Research and Policy. So are you confident that these vaccines can last beyond 6 months?
Well, they look good up until 6 months. Let's be clear about that. We've got lots of data to show that even at 6 months, the efficacy against severe disease, hospitalization, is in the 90+%. So that's all good. But Delta has thrown another wrinkle in here. And so we now have to really look and see, with Delta now becoming the vast majority of virus isolates in the U.S., is that going to affect the way in which this slow waning of immune response is going to be necessary to address? I can assure you and everybody watching that this is a topic of intense daily investigation by the FDA, the CDC, the NIH, and others, looking at every bit of data we can get our hands on from the U.S., from other countries, trying to assess exactly what's the right decision to make. But as of right now, it looks as if, even with Delta, our current vaccines are holding up really well. But watch this space. We're going to be checking this very, very frequently over the next few weeks.
So right now, a booster for someone who's immune compromised, but possibility that we all get boosters come the fall?
Well, I'm glad you mentioned the immunocompromised. Clearly, we do want to help those folks who have not been able to raise an adequate immune response from the standard dosing, and there is clearly an effort to try to make that possible ASAP. And that is a separate circumstance. Those aren't people who sort of needed a booster after 6 months. They're people whose initial immunization didn't quite take. For the rest of us, well, maybe this fall. I think all of us looking at the data will say boosters are going to be necessary at some point. The question is, what's the right timing? That's what we're really working to try to define from the most rigorous science that we can get our hands on.
It seems like there's a little frustration about getting the data, at least privately, from the administration officials, the policymakers. But can you definitively say to somebody that the vaccine provides better protection than the antibodies that you get from actually having had COVID-19?
Yes, Brett, I can say that. There was a study published by CDC just 10 days ago in Kentucky, and they looked specifically at people who had had natural infection and people who'd been vaccinated and then ended up getting infected again. So what was the protection level? It was more than twofold better from the people who had the vaccine in terms of protection than people who'd had the natural infection. That's very clear in that Kentucky study. You know, that surprises people. Kind of surprised me that the vaccine would actually be better than natural infection. But if you think about it, it kind of makes sense. The natural infection kind of gets into your nose and your airway. The systemic vaccine gets more of your immune system engaged and apparently does a better job of preparing you if you're going to see that virus again.
You said
that is a settled issue.
Data from all over, including overseas. The Wall Street Journal cites the UK data could be a positive indication, saying the latest surge of COVID-19 cases in UK is giving rise to growing optimism among doctors and scientists that the highly transmissible Delta variant of the coronavirus can be held at bay with high levels of vaccination and public caution, although caseloads are now ticking higher. Hospital admissions have been falling. Deaths are a fraction of the level seen in earlier phases of the pandemic. In other words, the UK, other places had seen a major spike, but that is really falling off as time goes on. Is that what we are to look forward to?
Well, one would hope. I think it's really hard to extrapolate from other countries' experience. And, you know, I'm a little concerned. When I saw the UK spike come down fairly quickly, I was encouraged. But look at the last week or so. It stopped going down, and it looks like it might be going back up again. This virus has so many tricks that we haven't completely figured out. You know, the bottom line, Brett, is if we in the United States want to avoid more cases, more hospitalizations, more deaths, if there was ever a wake-up call for the people who've not gotten vaccinated yet, this is the moment. Find out how to get that vaccine. There's a place near you that has it ready. It's free. It's available.
Yeah.
There's no time to waste.
And we put that up every day, Dr. Collins. Last thing, you know, as more and more information comes out, I remember your skepticism, the emails you sent Dr. Fauci at the beginning, and we've gone over that. We've asked you that about the COVID origins and the skepticism about it coming from the lab, and you clarified that you thought it was not a weaponized thing from the Chinese, but that it may have been a lab accident. It seems more and more pointing that way. Are you confident saying that, or closer to that?
You know, I don't think I have any more new information to be able to tip the balance. Certainly possible that this was somehow understudy in the lab, even though it was not human engineered from scratch. I'm quite confident of that. But how do we know the yeses or nos? I've looked at the report, certainly from the House committee. I think we're all waiting in the next 2 weeks to hear what the National Intelligence study is going to come up with. We've cooperated with them. We've answered lots of their questions, give them lots of technical advice, but I'm not privy to what their conclusion is going to be, and that'll be really important.
It will. And Dr. Collins, we appreciate your time. You're welcome back anytime.